Okay, my target audience is dental professionals, doctors, and I would say hygienists, possibly assistants. Um, so basically, the difference between sex and gender is that sex is physically and biologically being a male or a female. Gender is psychological and social traits that you basically pick up from around you or your feelings. Different behavioral differences between men and women. One, I did not know this, but I learned it during my research, was that women actually metabolize medications much faster than men do. And in a dental practice, a lot of times we will prescribe Valium for patients who are fixing to undergo a large amount of work at one setting and are apprehensive or nervous. And keeping that in mind, a female is going to metabolize that Valium a lot faster. So, depending on when they take that dose, they may need an additional dose prior to the procedure beginning. Um, so that needs to be kept in mind when you're making the prescription out. You may need to give a prescription for two for a female, where a male could probably get away with just one. Um, women also, another behavioral trait that's different between women and men is women tend to not show emotion, or they can hold their emotions more so than men. So it's important to really stay on top of a female patient, especially during a long procedure, to make sure that they're comfortable, that they're not feeling any pain, because chances are they're not going to tell you that they are, and they may be. A man is probably going to tell you, unfortunately, and they may cry about it. I don't know. But anyways, just make sure your patient is super comfortable, male, female, it doesn't matter the gender, just make sure your patient's comfortable, but especially women, because they tend to try to be a lot tougher when they're in the chair than men do. Um, as far as as far as the gender identity, this is not something that comes into play a huge amount in the dental office. Um, there's not a lot that we would need to change as far as treatment goes. Um, Other than knowing what medications the patient is taking. If they happen to be transgender, we need to know what medications they are taking. If they are in the process of actually going through the procedure to change their gender, we need to make sure we are definitely know what medications they are on, because that requires a lot of heavy dosing of hormones and all kinds of things that we need to know about before anything, before use of lidocaine, Marcaine, any of the numbing agents that we use in the dental office. Again, nitrous even. Um, Very important that we know what their medication background is. We need to make them feel comfortable. We need to know what their medical history is. Um, we need to be non-judgmental. We just need to talk to the patient and make sure that we understand everything that is going on. We need to be compassionate and mindful of their situation. They're probably nervous. They're probably scared that they're being judged. We need to make sure that they are super comfortable when they are in the office. Um, as far as the GBV protection goes, this can go for all of the genders. Again, in a dental office is going to be a different than a medical practice, but we also can see the signs of abuse, of neglect, of drug use, of alcohol abuse. It all shows up because your oral cavity is basically an open book to what's going on in your body. A lot of things, a lot of diseases, and a lot of things that are going on out there, that'll show up in your oral cavity. Cancer can start there. All kinds of things can start there. You can see when somebody is using meth because of the shape that their teeth are in. It's very important just to keep an open mind and an open eye. If you see something suspicious, that you believe that if a woman comes in and she's got teeth missing, like recently, and it's an emergency, you need to kind of dig around and see why that happened. If she's telling you that telling you something happened that doesn't sound right, carefully ask questions and see if there's an abusive situation, if she's been targeted by somebody, if she's being bullied by somebody. The same goes with the transgender population. They're scared. They're targeted by people who don't understand, their way of life. If they've been injured and they're too scared to report it because they're afraid of being judged, they're afraid of being shamed, they're afraid family members are going to find out. If it's something they're trying to hide, try to be super understanding. and talk with them the best that you can. I found that when I was with patients that there's times whenever you're in the room, just you and them, and you can just have a really nice, comfortable conversation, and they'll start to tell you a lot of things. Before moving to California, I honestly did not have to come in contact with any transgender patients whenever I was on the East Coast. It was just the area that I was in. It was just not that common, or it just wasn't talked about that much. Since I was in California, the very first office that I worked at, actually we had a teenager who had gone through the sex change operation, and it was when she initially came to the office, she was a female, and then as she was continuing her treatment in orthodontics, she became a male. So that was in the chart. That was something we were cognitive of. We knew what was going on. We, made him feel as comfortable as possible every time he came in for appointments. And that's really the most important thing, is to make them feel super comfortable that, they're safe there, nothing's going to happen to them there, and that they're going to be okay. A lot of what needs to happen with all of the genders is education. The hygienists and the doctors and all of the staff need to be educated on, male, female, transgender, all of it. We need to know what we're looking for. We need to know what the medical ramifications are for different different genders. Just like I had, for example, heart attacks. Men have different symptoms than women. They didn't know that until, several years ago, that women don't have chest pain, but they can still have a heart attack, where men will normally have chest pain. It's just education. It's, it's talking to your patient. It's communication. It's communication between everyone, and it's just making sure that you're doing everything possible to make your patient feel as comfortable as possible when they are in your chair, when they are in your office, and just know that they are in a safe place, and that if they need to talk about something with you, they can talk about it with you. They can disclose things to you. HIPAA is always in play. So, you're not going to be able to share anything unless you absolutely feel that it's necessary, that needs to be shared, which would be an abusive situation, especially if you're talking about a child or a woman or a man for that matter. So it's just, communication is super important to make sure that your patient is very comfortable and that you know what's going on with them. We need to, make sure you get a complete medical history. The medical forms, the history forms in every office, medical, dental, everything needs to be changed so that there are more questions asked, where they can disclose things, like especially like with the transgender, how they prefer to be addressed. Do they identify with male, female, whether that's the way they were born or not. We need to know those things so that way we can make them feel even more comfortable when they're in the office and in the chair for treatment, and know that that they're in a safe place and that they can tell us anything, and that they can talk about anything. We need to know medications. There are so many people that have no idea what medications they are taking, and even in the dental office, some of the stuff that we use can interact with medications that you're on. Super important that you even just write it on a piece of paper. Tell them to stick it in their wallet. Make sure you've got it with you all the time so we know what you're taking. Lidocaine, Marcaine, all of the different numbing agents that we use, they can interact with other medications that you're taking. Again, like I said, if we're going to prescribe you a Valium, we need to know if you're on some other psychiatric drugs, that a Valium is not going to be a good idea for you. It's all in the safety of the patient and treating your patient the best way that you possibly can to give them the best care that you possibly can. And because it's so hard for people to afford any sort of health care these days, not to mention dental. Dental is on the back burner when it comes to taking care of yourself, just because your health care is more important. So anything you can do to make your patient feel more comfortable, anything you can do in your office to make it feel more welcoming to everyone, that is like the main thing that I think is the most important for you to do, is to make everyone feel welcome and let them know that they're in a safe place, and that you're not judging them, that you're respecting them, and that you understand them. So anyways, thanks so much.